I am Rosary Español, and I will be doing the pathophysiology of bronchitis. So, bronchitis is characterized by overproduction of mucus and tissue change in the lower respiratory tract, which could be a bronchi or trachea. So the bronchitis has a mucociliary transport. So this mucociliary transport consists of pseudostratified epithelium lining with the cilia, and there are glands that encircles or encompasses all of it, which creates the mucus. So our respiratory tract has a mucus which protects or is our defense mechanism against foreign substances. So bronchitis has two types. It could be acute and acute and chronic. So the difference between the two of acute and chronic bronchitis is acute is due to two types of infection. So it could be bacterial or viral infection. So the bacterial infection is commonly caused by the Chlamydia pneumoniae, Mycoplasma pneumoniae, and Bordetella pertussis, while the viral infection, which consists of the 90% of acute bronchitis, is caused by parainfluenzae, influenza A or B, rhinovirus, coronavirus. So those are the common viral infection. And usually acute bronchitis affects pediatric patients or more like below 2 years old patients. And while the chronic ones is due to irritants. So these irritants could be from smoking and or overexposure of irritants through time. So it deteriorates the lungs. So it causes a lung injury to the patient. So the bronchitis is characterized by the overproduction of mucus. So how does this happen? So due to both bacterial viral infection and irritants, so this could cause bronchial inflammation. So how does this bronchial inflammation works? So the bronchial inflammation it will first call on our inflammatory responses. So it will call on histamine, interleukin 4, and interleukin 5 from our mast cell. So the first that it will call is our prostaglandin. Our prostaglandin is a hormone that is secreted that promotes constriction. So it will constrict the airways, which is a classic sign of bronchitis, which constricts our airway, and most commonly in the chronic bronchitis because it has a lung injury, so it has more smaller surface for air to come through. So it will narrow the airway, or more commonly our lower respiratory tract. And then after prostaglandin, the next is the macrophages. So our macrophages is part of our immune system. So the immune system is part of macrophages. So macrophages works with our leukocytes. So leukocytes are also are white blood cells. This too kills any viral or bacterial infection. So with our macrophages, there are also interferon gammas, and additionally for the interferon gammas is cytokine. So cytokine is a common inflammatory mediated response of our body. So through these three macrophages, interferon gammas and cytokines has inflammatory processes that could cause headache and fever. So these are the symptoms from the macrophage, interferon gammas, and cytokines because of their inflammatory processes. And for the leukocytes, which is our neutrophil that works with our macrophages, so this neutrophils causes the increase of permeability of our capillaries, and this causes exudation and swelling. This exudation and swelling is related to our next, which is our goblet cells has structural change. So this structural, our goblet cells is also found in our mucociliary transport, or within that area where our cilia and our epithelium cells are. So it will undergo structural change, which will create, which will increase mucus production. This mucus production will decrease mucus clearance. So usually our body, the overproduction could make it much harder for our body to clear this mucus. So the clearance is much more harder because the mucus is too much for our body to expel. So it will have a lower clearance, and then our mucociliary transport will have hard time to work. So this dysfunction will become this dysfunction of our mucociliary clearance will turn into cough. So our cough reflex is also called bronchospasm. So this is when our smooth muscle tries to cough it out. So this is bronchospasm. So this is also as well part of the coughing reflex. And also, because of this bronchospasm, we can hear wheezing and bronchi sounds at auscultation. So along with coughing in this mucus dysfunction or mucus clearance dysfunction is also chest pain. So this is commonly in bodies mostly chronic bronchitis, but this could also reflect acute bronchitis because our body also fights through our natural immune systems, our macrophages and leukocytes, to fight bacterial and viral infection, and then which causes the overprotection of our mucus as well. But even though and then if acute bronchitis is occurring more commonly over time, it could be a chronic bronchitis. So chronic bronchitis could become COPD through time. So this is a chronic obstruction pulmonary disease. So because lung injury because of acute over time. It will also over time have long injury, which is chronic bronchitis. And this long injury, which could lead to COPD, which is chronic obstruction pulmonary disease. Thank you for listening.